Hi, I'm Dr. Jenny Andrus. I'm an interventional pain management physician at Orthopedic and Spine Center in Newport News, Virginia. I get asked very commonly from patients, why can't I just be on opiates for my chronic pain? The simple answer is if they worked great, I wouldn't have a job, okay? Everybody would just go to their family doctor, they'd get a prescription and they'd feel well. That's the simplistic answer, they don't work that well. But there's a lot that comes with them and a lot of side effects and a lot of risk. In the 80s, 90s, even into the early 2000s, most physicians were being trained that opiates were what we used with chronic pain or acute pain. If a patient says they have pain, you give them opiates. There was no dose that was too high. Unless the patient stopped breathing, you could keep giving to them. We now know that that was a bad idea. Right? We used to be taught that when opiates were taken as prescribed with patients with pain, less than 1% would develop addiction. We know that's not true. In the early 2000s, we were being told maybe 5 to 10%. That's not true. Now we're being told maybe 1 in 4. So these are patients that are not trying to abuse their medications. They're not out selling them on the streets. They just developed an addiction to them. And physical dependence is a very different thing than addiction. Physical dependence means if you stop the medicine, you feel badly. Your body is used to it. You feel like you have the flu, essentially. That happens with most patients who have been taking them as well. And so we think about those things, but patients tend to tell me a lot of side effects that are negative and really impact their lives, maybe even more so than their pain does. Itching, feeling sedated, constipation, crippling constipation for a lot of patients. In fact, I have patients who say they have 10 out of 10 pain and they would rather deal with that than deal with a crippling constipation. The things that you don't see or that the patient maybe doesn't know is going on though is changes in their hormonal system and also changes in their pain processing. And this is a really interesting aspect for me because I've seen patients who've been on opiates for 10, 20, 30 years and they're coming to me as a new patient and their pain processing system is completely distorted. So they're feeling pain to a much higher degree than they were even before they got on the opiates. Their pain scores are even much higher than they were before they got on the opiates. So what do we do about that, you know? And it's difficult. We have to have that conversation of how do we get down on these medicines? How do we bring them down while keeping the pain at bay? And that's individualized. That just depends on the patient and what's going on with them. I think the good news is that we know now what harm can happen, particularly from the high-dose opiates and particularly for months to years of use, and that patients can get off of them, and that the vast majority of patients that I've seen that have gotten off of them or have gotten to a much lower dose are actually doing much better than they were before. So when it comes to patients wanting a prescription for opiates, it doesn't mean that when a patient comes in the door and they ask for a prescription for opiates that they're misusing. Certainly, and don't feel like you're being labeled if you're requesting those things. But something that we have to remember as patients as well is that patients tend to rate their physicians higher when they're prescribing them something. Whether it's an antibiotic when you have a upper respiratory tract infection, whether it's a pain medication when you have an injury or something that hurts. So patients tend to feel like the doctor's taking them more seriously if they give them a prescription. We as physicians feel like we did something, whether it was actually helpful or not, but we did something by providing the patient with a prescription. The problem with that is that we can cause a lot of harm too. So it does take some time. We have to balance that and patients have to understand that too, that we have to change the paradigm in how we're looking at what we're doing for a patient each office visit. Sometimes leaving without a prescription is much better than leaving with one.